So we've spoken so much about inflammatory conditions of joints, you understand. So now let's look at them one by one. So the first on our list is osteoarthritis. Osteoarthritis, of course. So osteoarthritis just have to do with there's inflammation of this joint. Okay, there's inflammation of this joint. So it's a form of arthritis. It's a type of arthritis. And inflammation of a joint doesn't happen overnight. It has to be there over time. So it's chronic. So it affects a lot of people worldwide. It's often described as a wear and tear condition, but it's actually a complex disorder involving the entire joint, not just the cartilage. Okay. So what happens in this? There's cartilage breakdown. The bone is changing, where you can have spurs, synovial inflammation, ligament and muscle weakness. All of it are actually involved in here. So symptoms is joint pain when the person is moving, or after the person has moved and is trying to relax. There's joint stiffness. You find out that you're not actually using the joint like you should, and after you rest for a long time, okay, the joint stiffness worsens up. Okay, swelling and tenderness, grating or popping sensation, reduced range of motion, bone spurs or visible joint deformities. So commonly affected joints will have the knees, have the hip, have the hands, fingers, the spine, the cervical and lumbar regions most of the times. Okay, so risk factors is common in people that are above 50. Women are mostly affected. If you are obese, you stand a chance of having it more. If you have joint injuries from trauma, okay, genetic issues, muscle weakness, okay, and poor alignment. Diagnosis is all those imaging, physical examination. You want to look at, this joint, is it still moving as it should, Then images like x-rays, MRI, joint aspiration, okay, just to rule out infections and all of that. So these are the different treatments. You can use medications, physical therapy, assisted devices, lifestyle changes, then also surgery options. If the joint is too spoiled, you have to replace the whole joint. Okay, so please, you can pause and look at the in-depth, all right, at looking at the examples and all right. We'll come back, we'll make more videos on osteoarthritis, which will address each of the components of osteoarthritis later on.